right, what is going on, everybody? Welcome back to another episode of The Release Valve. I am your host, Sean Hanlon, and on this podcast, we often discuss the importance of addressing one's mental health and how a lot of people kind of struggle with that. And today I am joined by an actual professional who works in the field of mental health with not only adults, but athletes specifically. I'm very excited to introduce Jimmy Moley MD to the show. Welcome to The Release Valve, Dr. Moley.
Thank you so much for having me. Excited to be here.
I appreciate you coming on. As I said before, it's not, before we started recording, it's not easy opening up and talking about things that make us feel vulnerable, make us feel exposed, make us feel seen to that degree. A lot of what we go through in life, especially our struggles, we kind of identify ourselves with. It kind of helps form who we feel like we are on the inside. And the more that we're able to open up and talk about these type of things, the easier it gets to kind of figure out who we really are and what we're actually capable of, right?
Right. Oh, absolutely. Yeah. Important conversations to definitely be having, especially in the current day and age.
Yeah, seriously. I think not to go too far down that whole path here of the COVID talk. But I feel like that was kind of a big eye opener for a lot of people. It was that time period and realizing how much they kind of go through the motions of their life. And then once their life was disturbed to that degree, it was kind of like, oh no, what do I do now? Who am I? What am I looking to do with myself? What can I do with myself?
Right. It was kind of the unique combination, right, of more time. So people, time to reflect, time to really accelerate the conversation about mental health. But like you said, also time to really reflect and pause, and whether that be away from work or school, and say, which direction do I want to head? So I think, like you said, obviously a lot of stress and anxiety, but hopefully we're launching a new path forward here where we're more open, able to discuss these topics and learn and grow from those experiences.
Right. Absolutely. So give the audience a little rundown of who you are and your history and what led you to what you're doing today.
Right. So I'm an adult and sports psychiatrist, and I'm based just outside of Cleveland, Ohio, just about 15 minutes south of downtown. I grew up, around this area, in the Cleveland area, went away for school for quite some time, Notre Dame, and then medical school and residency at Ohio State. And after that, decided to come up back to the Cleveland area and start my own private practice. So I see both adults, ages 15 and up, as well as athletes, and really focusing, on all forms of mental health treatment. So, we do kind of the more standard, treatment of depression, anxiety, ADHD type conditions, right? But then there's also this element of performance optimization, right? And leveraging mental health tools and therapy and different medications to really enhance performance and really leverage that as a way, really to live a more fulfilling, holistic life.
Wow, that's amazing. That is quite the resume there, and I mean, geez, with those credentials, did you know at a young age that that's what you wanted to do in life? Is that the direction that you saw yourself heading, or did that kind of just happen? Like, how did that get started?
It was a mix of both, I'd say. So growing up, I was always involved in sports myself, right? So playing different sports as a kid and in through high school. And my family actually had a fair number of coaches in our family. So I was exposed to that kind of athletic culture from a very young age. So I knew that I wanted to be involved, in sports in some capacity. So, initially in medical school and coming up, I thought, I'll do like sports medicine, right? Orthopedics, something along those lines. I did a fair amount of research and kind of went actually decently far down that path. And then actually it was my third year of medical school, right? And in the third year of medical school, you rotate through different specialties. So you get exposed to different areas of medicine. And I really had no past experience with psychiatry or mental health. And to see what struck me was the power of, that human connection, right? That there is no, in other specialties, there's more, you're fixing a broken bone, right? You're treating a calcium level, right? There's oftentimes very defined targets, right? In mental health, it's much less so, right? I feel like there's more of an artistic element, right, to that practice. So being able to really learn about people, to connect on a very human level, and to be able to use, my education and my training to enhance, how maybe they see themselves, how they perform, how they live their life. to me, that held, tremendous meaning. So then learning that I could combine that and also see athletes at the same time really kind of sealed the deal, right? So
Yeah, right.
that kind
Yeah.
of launched all that and became more involved with, organizations and sports psychiatry, talked to mentors and really, led me down this path. So I'm very happy with it. It may not have been, what I originally intended, but I think it worked out quite well, and I'm excited to continue to do this work.
No, that's amazing. That's awesome. I feel like a lot of kids growing up, especially in sports, you have a picture of how you see things are going to go, and it's usually a professional. I'm going to reach the peak, the pinnacle of the sport or whatever it is that I'm involved in, and a lot of times we're not prepared for what if that doesn't work out, or exploring other options or whatever it is. And even not just in sports, just overall in life, I feel like, especially high school, going into college and stuff, you're so young. And what is it? The frontal lobe, especially with males, isn't really fully developed until, what is it, like 25 or something like that? And
Right.
you're kind of pushed to know what it is that you're heading into and what you want to do for the rest of your life. A lot of people, they go to school for certain something and then that doesn't work out, and it's like, oh, well, now what, So that's
Absolutely.
really cool that you were able to kind of get in that area, the general area of what you're doing now, and really figure it out and have it work out for you. That's awesome. Kudos to you.
Yeah, thank you. And you think about, I think there's a parallel too with a lot of like youth sports culture, right? And this trend to really hyper specialize from a really young age. And you see, kids as young as, the kind of lower ends of grade school, playing, baseball, for instance, year round, right? And really different trainers and specialists and travel clubs and youth groups. And I think it's tricky, right? I mean, I understand the desire for that specialization and that really intense training. But I also think there's probably an element where you lose some of the skills that you come from trying different things, right? And exposing yourself
Right.
to different sports, different aspects of life, right? So, like you said, as you grow and develop, I think it's natural for interest to change, and really being open to that, I think, is always somewhat of important.
Yeah, absolutely, absolutely. I've seen quite a few instances where that pressure is kind of put on from the parents a lot of times. Sometimes the coaches and other people in our lives, but a lot of times, yeah, the parents will, this is what we do. Your grandfather was a baseball player, a football player, your father was that, so you're going to be that too. And yeah, sometimes, especially kids, they don't have that same passion or drive behind it, especially when it's kind of forced on them. And as they get older, you have less of that time of figuring out who you are as an individual, what you want to do with yourself. And like you said, I feel like it's so important to be able to explore different aspects of your life. If you are going to be a baseball player or a football player or, fill in the blank, let it be because that's what you want to do. Maybe you tried a few different things and this is what you found and that's what you're going forward with. I know it was awesome for me growing up. I mean, my mom had me involved in anything and everything that I showed interest in. Do you want to play soccer? Do you want to play baseball? Do you want to play basketball, football, whatever it is? Yeah, let's give it a try. And there was a lot of different things that I did try. I was an athlete a good portion of my life, and yeah, I was kind of an all-around athlete. I didn't necessarily excel in one thing over another, really, but I tried everything, and I thank her for that, because that was a huge part of my development on figuring out who I am, what I'm capable of, what I want to do, what I don't want to do, and having that freedom to make that choice myself and not have somebody else make it for me.
Definitely. Yeah, and I think you pick up so many skills along the way, right? And even if things that you may not think would be related, right? And things like hand-eye coordination across different sports, and from the
Right.
technical aspect all the way to the idea of individual versus team sports, and just so many opportunities, right? To grow as, just like anything else in life, the more you're exposed, the more you grow.
Absolutely. I love that. I love that. So I was going to ask, was there ever a time that you saw yourself doing something different other than the medical path that you went down?
There definitely was at various times. Actually in college, worked part-time as a sports broadcaster. And I thought that could have been the
Nice.
path. And I think there's probably some parallels right there,
Yeah.
explaining things and being able to describe what you're seeing, right. And convey knowledge. So,
Mm.
um, I think there's a lot of different paths. And I think that was one of the most important things for me is you learn people skills, you learn so many things along the way that I
Mm.
draw back from even now, in my work. I still pull back to those different jobs I had growing up and
Right.
different experiences in school. So I think it was very important for me. Obviously, the medical path is very long in terms of schooling and training.
Sure. Yeah.
And what I've noticed too is I've met a lot of, some of my closest friends along the way come from such disparate backgrounds, right?
Mm.
One of my closest friends was a zoology major, right, in college and ended up in
Wow.
medicine. So, yeah, and I think all those people bring different perspectives, right? So, I think
Right.
that's
Right.
probably what makes individuals more complex and dynamic and really enriching to talk to and be around. So, I think it's been helpful and, something I always encourage.
That's awesome. Oh, I love that. Yeah, I love what you said about, the different aspects and the different things that people can bring to the table and the different areas of expertise that they have that you in turn can learn from too, right?
Mm-hmm. Oh,
That's really
absolutely.
cool. So, I mean, it seems like sports was was the big driving thing. You knew in some way, shape, or form you were going to be involved in sports. Um, what made you want to specialize in athletes specifically? Was it the fact that you were an athlete growing up?
Yeah, I think that was part of it. And I think, when you think about, well, what does that mean? I think athletes in general tend to be very highly motivated, right? Very kind of future driven individuals, right? And
Mm,
I tend to think, in mental health that a lot of times when you have patients who are very motivated, hard workers, those tend to lead to the best outcomes, right? So
sure.
if you have people who are really dedicated and are willing to uncover every stone and really do everything they can to optimize their mental health, that's really the key to success. So I realized that this is a highly motivated group that's going to work really hard. So that was really interesting to me. I also think it's a relatively underserved population. Honestly, I think that this idea of athletes and intensity, right? That the implication I think there is like you don't show weakness, right? So there's
Mm, right.
any kind of mental health. I mean, the stigma is still very strong. I'm sure we'll talk about that too. But there's this idea that you have to overcome it and just kind of push through it, and the more effort equals more success, and that's not always the case, especially with mental health. So I saw a
Mm,
need, I saw an interest that I had, and able to connect with that population, and really just saw a lot of unique issues that athletes face. When you talk about things like retirement, injury, career
hmm.
changes, trades, and there's just so many things that I think need to be addressed and can be utilized in a way to really enhance an athlete's mental health as well as treat the times when things don't go well.
Right, right. Oh, I love how you said that, especially with athletes. They are talking about having an identity. That's who they are. That's what they do. Is whatever sport it is. That I am a huge mixed martial arts fan. I am a big, UFC fan, boxing, kickboxing, all that, and
Hmm.
that's something that I've heard a lot and seen a lot is that type of struggle that they go through, especially in combat sports. You got to be the tough guy or tough woman. There's no room for weakness there. You can't be vulnerable to that degree because you almost have to be almost like a robot in the sense that you don't have emotions, you just do the work, you do the job, and that's it. And obviously being human beings, there's a whole nother side of what we have going on internally other than the physical, right?
Hmm. Hmm. Yeah, it's so hard. And a lot of what I do is trying to decipher where the line is, right? And what I mean by that is there's so many skills that an athlete or an executive or anyone develops over the course of their life that allow them to be successful, right? So that hard work, that dedication, that almost at
Hmm.
times like a singular focus and intensity, right? That's
Right.
probably most or a lot of the reason that they're able to achieve the success that they are, right?
Sure.
But
Yep.
where does that cross that line in terms of now where is it becoming harmful, right? And how does
Right.
it really affect us? And whether that's sometimes it's after a change in environment, right? So an athlete
Hmm.
sustains maybe a career-ending injury, for example, right? And now all that intensity, that identity that helped them get to that point is really not as helpful anymore, right? So
Right. Yeah. Yeah. And that doesn't always translate to the real world, especially if you become a parent, if you're a husband or a wife, or, you have other people involved in your lives, you can't necessarily bring that same level of intensity when dealing with them. You can't be that emotionless, like I said, robot that, doesn't open up, doesn't talk about things because, you just got to do the thing. I've found that out kind of the hard way as well, being a parent. And coming from a generation of, my parents were workers. Yeah, my dad was an athlete to a degree growing up. He played basketball for a long time, and that was definitely something that when he was younger, that was a huge part of his life. Was you don't really open up about these type of things. And I feel like and he kind of had like a career-ending injury as well, and alcohol was kind of the way to deal with that for a long time. And then he had other setbacks in life, and alcohol was the go-to coping mechanism for him for a long time. He has since been sober for, I want to say, about 10 years now, which is awesome. Shout out to him for that. But yeah, that was a big thing for him, was not finding the correct coping mechanism for him to really work through the things that he had going on. Do you find that a lot? Do you deal with that? Or I should say, what are some of the more common aspects of your line of work that you run into?
Definitely. Yeah, I'll touch on that briefly, and then I'll talk about some more of the common issues too. I think the world in general, right, teaches us to avoid feeling uncomfortable or avoid feeling things that don't make us feel good, right?
Right.
On a very basic level, we're taught that, and it's probably instinctual on some level, right?
Sure.
So when we have those emotions, when we have that sudden change, we don't know how to deal with it. I think our natural instinct, adaptive instinct, is to do things that just don't make us feel that way anymore, right? So that oftentimes, though, can lead down dangerous pathways like alcohol or drugs or other ways to I just need to stop feeling how I'm feeling.
Right.
Whereas I think it seems counterintuitive, but is often the most successful pathway is to actually just face those challenges head on, right? And to experience the emotions, to learn from them, to really dive in and to say, we need to work through this. So inevitably, when I'm faced with a similar challenge, like you said, like at home or in a different aspect of my life, like I know I've been through this before, and maybe I've built up some skills that allow me now to be able to tackle that new challenge. So yeah, I think that's kind of a primary core component of it, I think what we work with. But to answer your question too, kind of the common issues. So I think, definitely injury, retirement are two of the main ones with athletes, I would say. There's also a fair number of mental health conditions that just have a higher prevalence in athletes. So you think about performance-related anxiety is definitely high on the list.
Yep.
ADHD, I think, is really becoming more and more understood and more maybe prevalent in athletes.
Okay.
Certain, substance use disorders, eating disorders, and actually PTSD is one of the conditions that has some of the highest rates amongst athletes. So, I think there's kind of that arm as well, where it's like we know that the things that everyone in the world population experiences on some level obviously affects athletes, and maybe the conditions of being an athlete lend itself to more maybe severe or intense forms of those illnesses.
Right. Yeah. So kind of having to rise up to certain levels, and the pressure that comes with that comes anxiety, comes post-traumatic stress, comes all these type of things, which can also then in turn lead to those injuries that we talked about, career-ending injuries, because you're pushing yourself, you're redlining, so to speak, and just go. And obviously, we're, like I said, we're humans. Eventually the body's going to shut down. It's going to say, no, I can't do that. Whatever it is that you're demanding of me, I can't do that. And then, so yeah, talking about identity, I am this athlete. I am this person that goes and does this. And now I can't. Who am I? What am I? What do I do? I can imagine the weight of that. And how, and like I said, talking about my father, and there's so many others out there that struggle with that, finding the right coping mechanism to deal with that, So yeah, I guess another question I wanted to ask was, how often do you deal with athletes after they are no longer athletes, or do you mainly specifically, kind of just work with them while they're in their athletic profession, or does that carry over afterwards too?
No, it definitely carries over. I think that's one of the main things. We talk about transition points a lot, right? And we think about how do we process retirement or injury? And I think the answer a lot of times is we almost have to treat it like a grief process, like almost like you've suffered like a loss, right? And
Really?
think
Okay.
about, like the traditional, like the 5 stages of grief and all of the grief work that's out there for, and most typically if you lose a loved one or things like that, right? But I think it's very helpful in a lot of cases to frame it as, a part of you now is gone, right? And we have to recognize that. We can't run from it. We have to acknowledge it and say, how do we learn from this? How do we, pick up the pieces? How do we understand now? How do we build up a new life for you? And do so in a way that both respects the past, honors the past, but pulls from it, realizing that it's probably going to take a new skill set to thrive in whatever new environment you're now in.
Sure. Yeah. Finding something else that you can focus on and
Right.
not be
Right.
so hyper focused on, the past. And, and that, I feel like that's a tale as old as time, that high school star with the Letterman jacket, something doesn't work out on the college level or the professional level. And then they're still going back and drawing from those, the good old days.
Right.
I even, not to make light of the situation, but I think of the show Married with Children, and Al Bundy, was constantly talking about, Pokai and how he had, X amount of touchdowns and,
Right. Right.
and it was clearly something that, he didn't move past from because he didn't go on to be the successful athlete, the successful football star. And, he ends up working at a shoe store and he's not happy there and he's not necessarily happy with his home life. And that's kind of the main focus point of that character for that show, is that this guy is very unhappy with his current state of his life. And he's constantly being drawn back to the good old high school days.
Right.
And like I said, that's a tale as old as time. I feel like that was a relatable topic, and probably why a lot of people at that time were drawn to that show was because, yeah, they can relate to that. That resonates with them to a certain degree.
Mm-hmm. Mm-hmm. And the challenge, I think, then, becomes, instead of being so maybe as reactive, how do we become proactive? And how do we work to develop identity in different aspects of life before those sudden changes? So we're seeing a lot of change, I think, in the way athletes think about and process mental health, right? It's out there more in the media. It's out there more in literature. Professional athletes are starting to speak up more. And as we try to capitalize on that attention and that idea and that awareness, I think we need to start to think a little bit more proactively and say, while things are still going on, are there programs, are there structures, are there educational opportunities for athletes to really enhance different parts of their life to prepare them for the inevitable changes that will come?
Right. Yeah. And speaking of, podcasts in and of itself, I've seen a lot more retired athletes starting up podcasts, and yeah, they open up about this type of stuff. And we as the fans were almost like, whoa, we're kind of blown away that, these guys actually have feelings, they actually went through things, or I didn't know that it was like that for them. And, oh, now that makes sense that, whatever happened, happened to them. You're right. You're definitely seeing more and more of that today. And I love it. I think it's a huge thing to be able to open up, and especially for those that don't see what goes on getting to the game or getting to the event or whatever it is. We don't know the lead up to it and what they're going through. We just judge them by the performance that we see. And, a lot of people sitting at home on the couch like, oh, this bum, or, I would have done this, or, whatever the case, you have those couch professionals. But yeah, getting ahead of it and being proactive ahead of time and talking about those things, or finding the right, solution to, or a coping mechanism to dealing with those type of things before it gets to that drastic, dire situation of, maybe something horribly wrong happening to them. That's huge. I'm a big fan of Andrew Huberman, Dr. Huberman. I'm not, if you are familiar with him. He talks about some of the most simplistic things that people can and should do with themselves. I think he calls it the pillars of health, right. And it's just like sleep, sunlight exposure, movement. It's like diet, your diet, social connection with other people, stress management. It's all these things that are so easily overlooked and ignored, or, like I said, people don't feel like it's a sign of weakness if you work on those type of things, like, oh, I can function off of 4 hours of sleep, or I don't need friends, or I could eat whatever I want. I know I had that mindset as a kid.
Right.
I definitely banked on the fact that I used to even say I have an iron stomach. I could eat whatever I want and I'm fine. And now that I get older, any like certain things can really set me off, and then that messes up my sleep. And if I don't sleep good, then yeah, my performance at my job isn't as good the next day or whatever. You have days, weeks, months, years of that behavior. That's going to have a really negative effect on the overall performance of your life, right?
Right. And yeah, I try to translate that directly into my practice. So when I meet with somebody for the first time, whether it's an athlete, an adult, whoever, right, we talk about treatment as being multifaceted. So I feel like a lot of times people think of psychiatrists as a lot of times the focus is medication. So
the pill doctor.
Right, exactly. And, especially, and a lot of times too, you get in big health systems where you have very short, appointment times or things like that. And the focus has to be medications. So that's part of the reason that I went into private practice, because I want to have bigger conversations, because I feel like to really commit to your mental health means a commitment in pretty much all aspects of your life. So, if we can give medications out all day, but like you said, if we're not optimizing sleep, talking about diet, exercise, social connectedness, then, we're really fighting an uphill battle.
Right,
So,
right.
Yeah, I feel like that it's so important. And especially I think now too, as more people are looking for non-medication treatment options and, really looking for more natural ideas and ways to really find balance in their life, that those conversations are now more important than ever.
I couldn't agree more. There was that time period of, I want to say it was in the 90s or something like that, where, you had doctors that were just throwing Oxycontin and, all those pills at people, just throwing it at them. They were getting, I imagine they get, an incentive to do so. I've prescribed X amount of pills, or, this and that and the other thing, so I'm doing my job. But that became a huge problem. What is it, like an epidemic, pretty much.
Oh, sure.
That was a huge issue for a long time period. And I feel like you're right. Nowadays, people are more aware of the dangers of getting these pills, getting hooked on these pills, and then in turn trying to come off of these pills. And people are ruining their lives. People are ending their lives because they're so addicted to this pill that's going to make me feel better. Or as we talked about earlier, in not having the right coping mechanism, I need to run and get away. I need to hide from what it is that I'm feeling, as opposed to getting to that root source of it, right?
Definitely. And every medication, of course, is a little bit different too. But I often describe as, medications can raise the floor of how we're feeling, right? So they can maybe really prevent some of those maybe darkest moments, or at least lessen the intensity or the frequency of those moments. But, we don't have a medication that brings you joy, happiness, fulfillment in life. Right. We know that those things come from life itself. Those come from life experiences and moments with family and friends. And it's, I think, the goal maybe of the medication to make you more available for those moments. But it still requires a fair amount of work, right? The medication is just one small fraction of the piece. But so if we're really trying to search for those moments, because the goal should not just be to not feel suicidal, right? Or to not have, serious debilitating anxiety. The goal should be fulfillment, optimization, and really embracing all that life can offer. So I think, medications are a part of that, but we really need to recognize that this is a full-throated effort in multiple areas of life.
Right. Yeah. The medication is like a crutch, Yeah, it's going to take the weight off, but it's not going to help you walk. Right.
Yeah.
So
the metaphor I use a lot is if you're drowning in the ocean, we need to get you to tread water first, right? We need to give you that space to breathe and really think, all right, now what do I need to do? How do I move on from my situation? How do I progress in life? How do I start to tackle these challenges that I'm facing? But you can't do that if you're drowning. So that's sometimes where we need to step in, right? And take care of that first. But then how do we learn to swim? How do we train those muscles? How do we build up the strength to really act within your own agency and, kind of impose your will on your life the way you want to?
I love that. I love how you worded that. Do you deal a lot with that people that kind of, self-diagnose, so to speak, and say, I need a pill for this, or I need medication for that, just give it to me type of thing.
Sure. Yeah, I mean, it does happen sometimes. I tend to use those moments to say, though, that they are recognizing in that moment that there is some problem, right? That it is a recognition that, hey, something needs to change. So,
yep.
And I don't fault anyone for not knowing the exact way to fix the problem, right? That's why you come talk to a doctor. That's why you come do your research and think about things. Yeah, so I want to use that as a moment. All right, I love that you're invested in looking for solutions, but let's talk about the best way to get there. And oftentimes maybe that does involve a medication for either a short or a long period of time, but I think then we'll bring in all those other things, and I think now especially people are very open to that idea, and really if you're that invested in looking for different options, you'll be mostly willing to do whatever it takes to feel better.
Right. Yeah. The times have definitely changed in that regard. People, like you said, are more aware of the dangers, the addictions and the setbacks of just looking for a one-stop shop fix-all pill that's just going to make me feel happy. And I love that you worded that, there is no pill that is going to bring you the real joy and happiness in your life. There's the work that's got to get done. Mm-hmm. And especially with the internet and technology and everything these days, it does make it a lot easier to get that help, to realize that there are the dangers, because that was the big thing back then was there was no other outside source of information other than what the doctor is telling you. And if the doctor's telling you take this pill, and you're like, okay, and you're just going to take the pill without understanding those dangers. So the power of Google, right? You can just jump on and what are the consequences of this and that and the other thing. So that's awesome.
Yeah, and I think that speaks to kind of to the availability of mental health professionals, right? Which is still a huge issue. There's a lot of people that live in parts of the country and the world where they just don't have access, right, to good care. So, then the question becomes, how do we maybe leverage technology to reach those people, right, and to use that? So, I think access to care and access to the right kind of high-level care is very important.
Absolutely. So when dealing with athletes, and I know you deal with more than just athletes, but especially obviously if they transition to no longer being an athlete, but while working with athletes, do you do a lot of work with other athletic personnel like coaches or trainers, or, and if so, how difficult is that to get on the same page with?
Oh, definitely. Yeah, I think one of the more unique things about being an athlete are the number of people who have an investment in your success. So you think about coaches, you think about trainers, you think about parents, agents, right? Kind of people that are involved in your inner circle and even your outer circle. People on social media, fans, followers, right? There's so many people that their, either their financial well-being, their happiness it depends on your level of success. So we have to recognize that, and we have to say, how do we, still focus on the athlete while also recognizing all of the pressures and the other people involved in the situation, and all those other people may have different motivations, right? And they may have different ideas for what the best outcomes are. So we have to balance it, because our responsibility is first and foremost to the athlete. We have to, maintain privacy, confidentiality, and really build that trust with the athlete so they know that it's my responsibility is primarily and first and foremost to them, right? So we have to do that. But then we also have to recognize that, they may see me, at most maybe a few times a week, once a month. They may see their athletic trainer every single day, right? And they may see their coach every day at practice. So those people have valuable information that can help me, that can help the athlete. So it's how do we have the right kind of conversations? How do we reach out with healthy boundaries? And really, gather as much information that will be used to help the athlete, while also maintaining the right levels of privacy and confidentiality to balance that relationship. It's a fine line to walk.
Right, I can imagine. Yeah, because you're gonna, as an athlete, you're gonna deal with a lot of different levels of engagement with people, and their like you said, their interest in what you have going on in your life, especially people like agents, that's going to be more of a, what have you done for me lately? What can you do for me going forward? A coach may be a little bit more invested in your personal, more so than that. And obviously parents are going to be more involved in that. But yeah, I can only imagine how hard it is for them, and also the people like you in their lives, that it is to juggle all of that and to make sure that you're actually doing what is best for this person as a human being, as a living, breathing person, and not just while they're an athlete, while they can give something back to me. Because, as we talked about, there's more to who we are other than, just being this athlete, again, especially as you get older, and as you get to that latter part of your career, or even just your life overall, there's more to it than just the performance aspect of it. And, we need to make sure that we're okay coming away from that, right?
Definitely. And, athletes can tell when maybe your interest is divided, or when people don't always have their best interest, because they've experienced that kind of thing in most cases their whole life, right? People that maybe have ulterior motives when they deal with them, or different people in their circle. So, athletes, I think, are some of the best people at recognizing honesty and authenticity. So that remains the top priority. And, it's part of the reason, too, that I decided to be an independent physician, right? I don't work for a team. My paycheck doesn't come from an organization, a hospital system that has financial investments, sponsorships, that kind of thing, right? Like, they know when they see me that I, the relationship is between me and the athlete directly. So I think that's important. I think especially as you get in the higher levels of sport, that becomes very critical, because so much of what we do is based on trust.
Sure. Yeah, absolutely. Absolutely. Yeah, you're right. I feel like they are going to have the best judgment overall. But, especially if you're younger, it's hard to kind of figure that out, because again, we're looking in that far direction in that picture, and who's going to help us get there? Well, this agent is going to help me get there, or this coach, or, this trainer type of thing. And it's a lot harder to focus on the right now in the right way, and focus on the future in the right way as well, because you are only looking at the picture so far. You're only looking at that one portion of it, and not, the entire thing, the latter half of it, as I said. Right. So is that one of the reasons why you felt it was what you wanted to do was work with, what did you say, it was like 15 and older, or adults? It made it a little easier to work with them in that regard, and because they didn't have that hyper focus on the right here, right now?
I think so. Yeah, I enjoy working with adults. I think, like child and adolescent psychiatry is kind of its own subspecialty too, and I think that there's a lot of great work to be done there too. I found, what was most meaningful for me was to work with kind of that high school on up level, which I think has been very fulfilling. But I think, there's bottom line is there is just tremendous need everywhere for high level professional mental health care. There's no wrong answer when it comes time to decide what to specialize in.
Right. Sure. Yeah, absolutely. So one of the things that you mentioned earlier was removing the stigma behind dealing with mental health, or even just addressing it. How do you go about addressing it with your patients?
Yeah, it's tough. It's probably one of the biggest things that we have to deal with. And honestly, a lot of times that even happens before they become a patient, right? It's knocking down that initial barrier to getting someone to come see you. And that could look like, maybe like, I do some like public speaking and a lot of education to teams and organizations to just make sure people are aware of what kind of services exist out there, and what treatment might look like, right? I think the idea of maybe what is psychiatry or what is mental health care has changed over the years. We don't, as much do the lie on the couch and for, an hour every day and tell me about your childhood, right? There's different ways, and there's a role for that too. But understanding like what does mental health care look like? What are reasonable expectations? That's step one. And then step two is when you get an athlete who does want to seek help, how do you make them feel that they can trust you? How do you make them feel that they can be open and really share what they're going through? And I think you do that by being authentic, and by letting them know that what they're going through is very common, right? It happens to a lot of people. Yep. And that, this is something that, we have decades of medical literature and scientific evidence on how to tackle. So knowing that there is a path and there's a plan, I think athletes are very, plan driven, right? And outcome driven. Right. So if we can lay out a game plan and a schedule and a regimen, then that always helps. So I think there's a lot of different tools, right? Kind of along the way. But what I've kind of found too is that, they have to make sure, you have to know that they need to know that you're accessible, that you're there, and that you will be there to treat them, whether they're feeling well or going through a rough time.
Right. That's so important. What you just said about even if they're feeling well, sometimes we feel like, we only need help if, something's wrong or whatever. We get that help and then we move on. Mental health is an everyday thing. It's an everyday job on yourself that you got to put in, even when you're feeling good. And that's another aspect of this podcast. I think when I first got started, a lot of people were like, this guy just wants to open up about, problems and issues and stuff like that. And for me, it's like, no, I want to talk about those wins too. I want to talk about the successes that we have in life, because I feel like that's important to focus on, especially when you're not feeling good, is that there are those times that you can feel good. There is a light at the end of the tunnel. You've either been there before or you can get there. And I love that you said, a lot of people can feel like they are alone in what they're feeling and what they have going on. And so if they know that others have gone through it and made it out the other end, and here's how, that's a huge step in getting that person to recognize that, again, there is a light at the end of the tunnel. Right. You're not in this room of just darkness and there's no way out. It is what it is, and you just got to learn how to live in that space. No, you can go, and there are things that you could do. There are steps that you can take that are going to make things better. And that's why I want to talk about those type of things too. I want to talk about what it is that we've done, the work that we've put into ourselves and how it's helped, the things that, that we've done that have helped other people, because a lot of times people don't feel like that they can provide a service to others. Sure. Just by opening up about the things that they've gone through. There are so many people that they feel like, again, they almost identify themselves as the person that has gone through those struggles, the person that, nobody else will understand. And if you open up and talk about those type of things, other people can learn from you, right?
Right. Definitely. I mean, life and sports are a collection of shared experience, right? That's, I think, where we find moments of value. That's where we create long-lasting memories and are able to build connection. So, anything that goes through, there's a good chance that somebody else, has or will go through something similar. So,
absolutely.
How do we kind of use that? How do we amplify voices that have both been through hard times or even maybe still be in hard times to show that not only, can we expect this to happen, but there's ways through it. There's, like you said, there is that light. People have done this. There are ways to feel better. And that goes, like you said, for the good moments too, that how do we build up that resiliency and good times that when the inevitable, dips come in, that we're able to take them in stride and use the skills that we've learned when things are good to help kind of smooth things out over time.
Right. Oh, absolutely. Absolutely. So in your line of work, what do you feel are some of the more difficult aspects of your job that you run into?
Yeah, we've touched on a few. I think stigma is still probably number one. As far as we've come, there's still tremendous stigma around mental health. I don't mean to say that all the progress has erased that. I think there's still this idea of, needing to tough through things that, mental health can be fixed with hard work and dedication, which I guess in some cases can be true depending on the issue, but oftentimes is not, right? The other is access to care. It's such a critical point. We need more psychiatrists. We need more high-level care. We need better access to care. Mm-hmm. So, it kind of goes hand in hand with stigma too. If I'm an athlete or if I'm just an individual out in the world, I don't know where to begin to look, right, to seek help. Then it just becomes that much harder, right? So I talk about all the time of trying to reduce the number of barriers to people getting into care. So if that means, I keep my practice relatively small so that, I can see new patients within a week, right? It means making myself accessible in the community and doing public speaking events, because oftentimes that's just as important. You never know when somebody might hear something and say, wow, I know somebody dealing with that, or I myself am dealing with that. So accessibility, conversations about mental health care, but we have so far to go. That's clear. I think we still see all the time stories, whether it's in the world of athletics or outside, with the suicide rate and rates of depression, anxiety, and issues that are really just a massive problem for the country and the world. So long way to go. Obviously many challenges, but people out there doing good work, I think, to turn it the other direction.
Right. No, absolutely. I love that you're getting out there and doing public speaking, because, again, as you said, you don't know who needs to hear it. And sometimes these people don't even know that they need to hear it. You go to a school or whatever it is, they're just doing it because they have to or whatever. But then they hear about what you're talking about. It's like, oh, I've experienced that, or, oh, I feel that, or I know somebody that's going through that. And then that kind of opens the door for them to either, if it's themselves, they can reach out, or they can reach out for the sake of somebody else. Like, hey, how do I go about dealing with this? I know somebody that has this going on, what can I do to help them? Again, you don't know what you don't know. And unless you're having these type of conversations or exposing yourself to hearing these type of conversations, you don't know that there is help and that there are things that can be done. You're right. I feel like it's definitely come a long way. I am kind of getting stuck back in the 90s, early 2000s, and how things were back then. And, in this day and age, it's definitely, I feel like a lot more people are addressing the elephant in the room. As opposed to tiptoeing around it and nope, we don't talk about that. We can't go down that road, or for whatever reason. So I love the fact that you're not just doing what you're doing, but you're going out there and talking about it too, being proactive, as you said, and having those conversations up front. Even if it's just you talking, somebody needs to hear it.
Right, absolutely.
So obviously the stigma around, addressing one's mental health is absolutely one of the harder aspects of what you do. What are some of the more rewarding aspects of your job and the feel goods that you get from it?
It happens all the time, honestly. And it's the smaller moments, right? When you're working with somebody and there's sometimes where we have like big breakthroughs, right? Or things like that, but it's more of those kind of over time, those small, like, hey, I've really noticed that this really used to bother me, and now I'm thriving in this area, right? Or I was able to overcome my performance anxiety, and I did well at a track meet or a swim meet or a big game, things like that. Those are the moments that really are super rewarding. So, and I think it shows too that no matter how dark things seem, like there are ways to move forward, right? It kind of gives you hope that there are ways that people have done this before. That no matter how bleak things seem, there's always options. And I think that's something I always try to stress, that life is probably going to be full of ups and downs, but to really kind of savor, like you said, savor those moments where things are going well, celebrate them, recognize them, learn from them, and then in the moment just try to make them as frequent as we can going forward. So I always appreciate people who are invested, willing to work on things, and even sometimes in moments where it doesn't go well, we're able to maintain that hope and that resilience that I think is so important to mental health care.
Right. Have you dealt with somebody that was very resilient at first, didn't want to go down this path, maybe they're an athlete in the school and they're told to go see you and this and that, and then they've had that big turnaround, kind of like, hey, I didn't even want to do this, but you helped me get through it. Thank you. Have you had a lot of those moments? Oh
yeah, all the time. I think, mental health is a little bit unique in that a lot of the illnesses, like part of the problem is that the illnesses convince you to do things that further the illness, right? So like when you're depressed, like your depression kind of tells you, hey, stay in bed all day, don't get out, don't get moving, you don't want to do these things that will help you. So it's an illness that really perpetuates itself. So it's a huge challenge, right? And that I think leads to a lot of resistance to seeking care. But a lot of times once you do, and we're able to get things even, if it's 5, 10, 15% better, right? It's those small gains that we know that if you're facing these huge challenges, how do you do it? One step at a time. So, no, it's one of the more kind of rewarding things I do. I love working with athletes and really anybody working through challenges, and to see that growth in one way or another is the best part of my job.
That's awesome. I love that. I love that so much. Because a lot of times when you're in the heat of it, you have all that fog in front of you and you can't see down the road, you don't see very far. And especially I feel like that's why it's so important to get help, because a lot of times we're not able to remove that fog on our own. We're so hyper focused on the issues that we have. And as I said, it almost becomes our identity sometimes that, I am that person who deals with this. I am that person that struggles with, fill in the blank. I have PTSD, I have anxiety, I have ADHD, that is who I am. And so if you remove that from me, who am I? Right. And I heard this quote recently. I want to say it was from Robin Williams of all people, that talked about, people don't, I'm going to butcher it, but pretty much it was, people don't fake being depressed, or they don't, something along those lines. And I feel like that's kind of true to a certain degree, but I feel like there are also a lot of people out there that do kind of not necessarily fake it, but lean into it and look for it almost, because again, it's part of their identity.
Right.
And, there's the saying, like, it's okay to not be okay. It's also okay to be okay. It's
Right.
okay to get
Right.
better. It's okay to not have to go through these struggles. You don't need to go through it because it's familiar to you. It's part of your identity. It's okay to get help. It's
Mm-hmm.
okay to get better. It's
Mm-hmm.
okay to get better to the point that you no longer need help. It's even better to get to that point and then start helping other people. They have the other saying, I'm throwing a lot of quotes out there, but hurt people hurt people. Well, I love the saying that healed people can heal people too. And I feel like that's a huge aspect that gets overlooked quite often.
No, I totally agree. Yeah, I think that it's a big challenge, especially for people who have not felt well for a really long time, right? They
Right.
almost forget what it feels like to feel normal, right? Or to feel like
Right.
back to your baseline. So it's a huge challenge. And I think in those moments too, we have to rely on other people too who know and care about us, right? Because it's somewhat
100%.
times that, if you're blinded, like you said, by the fog, sometimes you can't lead yourself out. And maybe it takes a friend, a parent, a coach, whatever, to pull you through that. And, that's a hard step to take, but oftentimes is sometimes the only way through.
Right. Absolutely. Absolutely. Well, Jimmy, thank you so much for coming on here and discussing what I feel is one of the biggest issues that we have, not just in sports, not just in adulthood, but just overall in life. Mental health is often and easily overlooked, kind of brushed under the rug. And having people like you out there that are not only doing the things that you're doing, but having the discussions that you're having, putting yourself out there, being vulnerable to that degree and helping other people be vulnerable in turn. It's not only life-changing, it's life-saving. So, I mean, thank you for doing what it is that you do. I know I could have used somebody like you growing up. So I'm happy that, as I am a father who is raising kids in sports and just raising kids. It's good to know that there are people out there like you that are doing the things that you're doing. So thank you again. For those that are looking to reach out and get involved in your service or help or whatever it is, how can people get a hold of you?
Absolutely. Yeah. The best way is probably through my website. So the website is jimmymoleymd.com. I'm also pretty active on social media on Instagram at Jimmy Moley MD. So anyone can reach out that way. Always happy to have conversations, and whether I can help you or at least point you in the right direction, I'm always happy to do so.
That's awesome. Like you said, it's so important, and more people need to get involved, right? So thank you again for coming on here. And for those that are listening, I thank you as well, and we'll see you next time.